Hi, my name is Sydney Morris. I am the Community Engagement Manager for Cradle Kalamazoo, and I am so proud to be here as the official MC for Kalamazoo County's expansion launch. We started in the City of Kalamazoo in February of 2025, and we have seen such amazing support and love for this program, and that love and support has gotten us here today to launch in the City of Galesburg, Oshtemo Township, and Wakeshma Township. Today we're going to hear from a lot of amazing people who have supported this program and continue to support it. And so for starts, I would like to introduce my boss, our Executive Director, Ms. Jamaica Patrick Singleton.
Good afternoon, everyone. My name is Jamaica Patrick Singleton. I serve as the Executive Director of Cradle Kalamazoo. On behalf of Cradle, I want to warmly welcome all of our community stakeholders, partners, leaders, advocates, and residents joining us today. Thank you for being here and for your shared commitment to supporting children and families across Galesburg, Oshtemo Township, and Wakeshma Township. Today marks an exciting and meaningful step forward as we gather to discuss the expansion of RX Kids into these communities. This initiative represents more than a program. It represents an investment in families, in equity, and in the long-term health and well-being of our children from the very beginning of life. We know that strong communities are built when families have the support they need to thrive. RX Kids is designed to help reduce the financial stress that so many families experience during pregnancy and early childhood, while also reinforcing the message that every baby and every family matters. This work cannot happen in isolation. It requires collaboration, trust, and a shared vision across healthcare providers, schools, local governments, nonprofits, businesses, faith communities, and residents themselves. That is why your presence and partnership today are so important. As many of you know, Cradle serves as the collective impact organization and community champion lead for the RX Kids program. In this role, Cradle works to bring partners together, align resources, elevate community voice, and ensure that implementation is rooted in the unique strengths and needs of the communities we serve. Our responsibility is not only to help coordinate this effort, but to also help build sustainable systems of support that center families and create lasting impact for generations to come. We are deeply grateful for the collaboration already taking shape across Galesburg, Oshtemo Township, and Wakeshma Township. The willingness of leaders and organizations throughout these communities to come together demonstrates what is possible when we lead with collective purpose, with shared purpose and collective action. As we move forward, we hope today's conversation sparks new ideas, strengthens partnerships, and reinforces our shared commitment to giving every child the healthiest possible start in life. Thank you again for being part of this important work and for helping to make this vision a reality for families across our county. We look forward to working alongside with all of you as we continue to be building stronger and healthier communities together.
Thank you, Ms. Jamaica. All right, next I would like to welcome Dr. Mona Hanna, who is the RX Kids Director and Associate Dean of Public Health at Michigan State. Thank you so much for being here. With baby in hand, as always.
This is the why, right? This is the why. Do we all love this baby? Do we all love all babies? Yes. Will we do everything to make sure that our babies can thrive? Yes. So this is the community that birthed the promise, right? the promise that every kid can grow up to be healthy and successful. And so I think of our kids as like that pre-promise, right? Making sure that we are investing in the most critical window, this maternal infant window that is so consequential. What happens in pregnancy, what happens in early infancy shapes an entire life course. So ARC's Kids is all about saying, we love you, and we want to make sure that you have what you need to thrive. So ARC's Kids started in the city of Flint over 2 years ago as a proof of concept with the intent that we would be here today. It was always about building something that we could share with babies and families and communities across Michigan. And it's common sense. We're not doing anything that is brilliant or genius. This is done around the world. Families struggle the most around the time of pregnancy and infancy. Income drops, we don't have paid leave, expenses rise. 50% of moms have to go back to work in this country at 2 weeks of age. Can you believe that? I know, can you believe that? It's crazy. It's just wild that we don't care about mamas and babies. But we are changing it. We are changing that vision of how better to care for our little ones. So ARC's Kids comes alongside families with a little bit of economic support. In mid-pregnancy, every mom gets $1,500, and then once a baby is born, it's $500 a month. And here in Kalamazoo County, like in Flint, it extends to 12 months, which is amazing. And thank you to Philanthropy for making it go all the way to 12 months. Let's give them a round of applause. There you go. So we've learned a lot since ARC's Kids started, and everything is really consistent with that global evidence-based and the evidence-based from here in this country, especially during the expanded child tax credit when we did something very similar. We've learned that families are more stable, that they are able to make ends meet. We have less evictions. We have less people who are hungry, more folks able to buy diapers, which is really, really important and expensive, right? It's about $100 a month just to buy diapers. Go ahead, you want to talk? Yeah, I know, I agree. So families are more stable, health is improved. We're seeing significant improvements in in maternal mental health. We have less postpartum depression, less stress, less anxiety. Look at these like fine motor skills. And look how smart this baby is because he's an RX Kids baby. And we know that babies put everything in their mouth because that's how they see the world. Sorry. All right, so what was I saying? So families are more stable. We have improvements in maternal mental health. We have improvements in healthier babies. We had a big article come out in the Lancet last week, which is a really big deal, showing population-level improvements in birth outcomes. Less premature babies, less NICU babies, and less babies that have to be in the NICU, which is also really expensive. We had an article come out in JAMA Pediatrics a couple weeks ago where we're seeing a prevention of child welfare involvement, the CPS system, and the peak age of involvement in that CPS system is the first year of life, and we saw a 32% reduction in CPS involvement around infants. That's amazing. So we are narrowing those disparities that are stubborn and intransigent, and with one simple intervention, giving mamas and babies a little bit of economic support during this window, we are improving health at a population level. So we are so excited to be here. We are thrilled. We are grateful for so many folks for making this happen. We would not be here without our community champion, Cradle Kalamazoo. Let's give him a round of applause. So the city of Kalamazoo was the first city that launched after Flint. They came together, a huge round of applause. They came together and said, we want to do this too. And they were patient with us. And they were like the guinea pigs of expansion. And they learned with us. So we are so grateful. We've been working together now for over a year. So thank you to our community champions. Thank you to all our funders. So RX Kids is what we call a public-private partnership. We have public dollars from the state of Michigan. So kudos to our legislators are here. We'll get them. The legislators are amazing. But we also have private dollars, so thank you to all our funders, the community I'm not going to say the Community Foundation, Stryker, and many, many, many other funders have come in to unlock those state dollars. So let's give our funders a huge round of applause. This program is led by Michigan State University. We have partners at the University of Michigan, which is crazy, like the two schools working together, but we're on team babies. But it is administered by Give Directly, and we'll hear from our awesome partners at Give Directly, and they are the international leader in figuring out how to give people cash. And they're the ones that are kind of on the ground from our community, in Michigan communities all over, making sure that this is possible. So thank you to this entire village, and this whole village is here today, making this possible for not just this one, but for thousands and thousands of Michigan families. So it is an honor and a privilege to be here with all of you today, and we're just so very grateful. Thank you, everybody.
All right, thank you, Dr. Mona. Don't you all worry, you will see more of our baby Shiloh later on today when his mama talks. Isn't he just the cutest? Of course, because he's an RX Kids baby. So next, I would like to present Michael Horrigan, president of the Upjohn Institute, a champion for babies.
Thank you. I'm not going to be able to top the baby, and I'm not going to touch the microphone. So I'm actually the boring data guy, all right? But I want you to remember, a couple numbers. 10, 40, see if you can get all these straight. 2.4, all right? And let's see what these mean. We did a study of the Flint program. And what we'd love to do is studies on all the programs. But what Flint shows us is that it works. And in that process, $10 million was given out to the recipients. A little bit under, 9 point something, call it 10. So 10 million given out. And what was the implication? It raised personal incomes up to $40 million. Now, we have a couple different models, we get different estimates, but let's go with the 40. $40 million. In other words, when money is in the hands of people, they spend it. And when they spend it, whether it be on baby stuff or whether it be on rent, whatever it is, it comes back to elsewhere in the community. One person's spending is the next person's income, which they then spend, and that multiplies all the way through. Anybody here take macroeconomics, boring macroeconomics? Remember the multiplier effect? Right, okay, all right. We'll go to the bar later and talk, all right? So that's the 10 and that's the 40, all right? But then also, there's another 40. This is a progressive program in the sense that who receives the money? Yes, it's open to all comers. It has very little in the way of having to, for validation, for verification. But the people receiving the money in Flint, it was a very progressive program. 40% of the benefits went to those in the lowest quintile of the household income distribution. So it had a big impact on those at the lower end of the income distribution. Now, two other numbers, 2.4 and 200. Let's start with the 200. 200 is our estimate of the number of jobs created. This is a big deal. When you talk about jobs in a local community, we're talking numbers in that 50, 100, whatever. This is 200 jobs being created as a result of this increase in expenditures. In some ways, this is kind of like any program that gives money for any purpose, but in this case for such an excellent purpose, but then it has these positive impacts. And we expect these kind of positive impacts in Kalamazoo and in all the other communities that we're going to be located. And then what's the 2.4? 2.4 is what the business community wants to know. This is where they say, give me the bottom line. 2.4 is the return on investment. In other words, it is the amount of money generated divided by the cost. 2.4 is the multiplier, if you will, at the end of the day. This is a great impact, at least for Flint, and the hope is, the expectation is that we'll repeat it elsewhere, including Kalamazoo. Thank you.
Thank you so much. And I would just like to say too, of course we lead by love, but also the data shows, and it's just as important as that love, because data means that what we are doing matters, right? And showing that every day. And with that being said, next I would like to present Dr. Grace Labwama, President and CEO of the Kalamazoo Community Foundation.
I wanted to carry the baby. Should I carry the baby? I'm a mother, so I love babies. Oh, I really do. I really do. He's such a good baby. Thank you so much for all of you being here. My name is Dr. Grace Labwama, President and CEO of the Kalamazoo Community Foundation. The mission of the Kalamazoo Community Foundation is very, very clear: to create a thriving community by mobilizing people, resources, expertise to advance social, economic, and racial justice in our community. So I want to take this opportunity to thank all of you for being here. And for those of you who have worked so hard, our partners with Credo Kalamazoo, the legislators, everybody who has worked so hard. I see so many faces where we have said, not on my watch will another baby suffer in this community. And that's what this commitment is about. We are so grateful for all of you. This is just the beginning of the hard work to happen. We are so excited that we were able to do work in the city of Kalamazoo and now expanding in Oshtemo, Galesburg. Where else are we expanding? Wakeshma. That is an expansion, and I hope that we continue to do this work across the entire county, because we know that the infant mortality statistics in our community, even though we are working hard to improve them, they've been a reality in this community. And closing those racial disparities that exist. And programs like the RS Kids are very instrumental because they support the economic mobility for families and making sure that every family in our community, every birthing family in our community has a resource. Some people may say $500 is not a lot of money. That's a lot of money for some families. That's a lot of money for me. $500. And if our community is rising up and doing that for families, we should be proud to do that. The Kalamazoo Community Foundation is excited, and we play the role of the fiduciary. So that means we partner with philanthropy partners in this community to raise resources so that these programs can continue to work. So I want to thank all the partners, all the private foundations, the donors that have mobilized resources so that we can continue to serve and do the work in this community. I'm going to make sure that I said all the things that my team wanted me to say. I'm not good at following scripts. I am not good. But really thanking all our partners. Did I take anything away from you? You have everything? Okay, good. Thanking all our partners for all the work and believing in the work. The Kalamazoo Community Foundation, we are committed. We want to continue to be a trusted philanthropy partner in this community, whereby every dollar that we receive matters. And we want to make sure that we continue to create a thriving community, a community that is equitable for everyone, including our babies, including our birthing parents, including our mothers, including everyone in our community. So once again, thank you so much for being here. Thank you.
Well, I know, today is going to be the Shiloh show. Tricks on you all. We thought we were going to be here for this launch. We're actually here just to appreciate this one right here. And now that everybody else has had a turn, I feel like it's about time I had my turn, because I haven't seen him in a hot minute. So next, I would like to introduce William Buster, who is the Executive Director of the Stryker Johnston Foundation. Would you like the baby too? All right.
No, it would just be my luck that I dropped the baby on camera. No, we cannot have that. Listen, I am overjoyed to be here today. I came back to this community a little over a year ago, and one of the first things I heard about was RX Kids when I joined the organization, and I told the team then, we need to double down. However we need to figure that out, we need to double down, and that was before we heard about the opportunity to expand it to other parts of this county. The Stryker Johnston Foundation believes that Kalamazoo should be a place where generational poverty no longer exists. Thank you. And RX Kids is one of those opportunities that we have to make sure that that happens. First of all, I'd like to thank all of our partners who've helped make this moment possible. I'm not going to say all the names, but I definitely want to raise up Dr. Mona and all the work that you've done. Thank you so much. Thank you to our state legislators who took the opportunity to say we're going to lead and expand this, and our monies are going to be the ones to be able to leverage those dollars to bring it to our community. Thank you. Yes, absolutely. Thank you to Cradle and all the hard work that you do, my partner, Dr. Lubwama at the Community Foundation, and all the other organizations. But most importantly, I want to thank the families who will be the most important partners as we expand this. Without the families, without the opportunity to support the babies, we can't do the work that we want to do. At the Stryker Johnson Foundation, we believe you can tell a lot about how communities operate by how they support children and how they support the most vulnerable. We believe strong communities are built when families have the support and stability they need to thrive. We're proud to support the expansion of RX Kids to the City of Galesburg, Wakeshma Township, and my own community, my own neighborhood, Oshtemo Township. That's right. 12th Street in the house. What makes RX Kids so powerful is its simplicity. It trusts families. It recognizes that parents know what their children need. This program is also rooted in something larger than financial support. It reflects what can happen when organizations, institutions, local leaders, and communities work together around a shared goal. We are committed to partnering with organizations that are building healthier, stronger communities across this county. We see this work as part of a broader effort to expand opportunity, strengthen community-wide well-being, and help communities build stable futures for the next generation. Progress happens when people stay connected, listen to one another, and continue to show up over time. That's why partnerships like this are so important to the Stryker Johnson Foundation. None of us can do this work alone. Today is exciting because it reflects the kind of community we want to continue to build together, one where families feel supported, where children have a stronger start, and where people across Kalamazoo County, our county, see themselves in hopeful futures. We stay committed to this work. Thank you very much.
All right, so baby update. He's gonna be with me for the foreseeable future. Sorry to all of you. Sorry, Naisha, most importantly, his mama. So I would next like to introduce Chair Jen Strebs, who is part of the Kalamazoo County Commission.
Good afternoon, everyone. I am Jen Strebs. I'm so happy to just be here today to reflect on this moment for our community, to look out across all of the faces here that collaborate and advocate for what's best for the future of the children that live in our community. And we hope and are so excited to see this expanding further to impact more children, more families, and more outcomes into the days ahead. Dr. Mona, you mentioned how what we've endeavored here through your leadership as a solution that's not a complicated one. But what is complicated sometimes is finding the political will and the imagination to just dream, what if? What if we just allow people to have the conditions they need to thrive, the resources that they need to love and support their family? And this community is one that steps forward over and over again when asked, can we meet that challenge? We say that we can. That spirit of love and support and forward thinking is what makes Kalamazoo not only a special place to live, but a place that can lead not only our state, but our nation as a role model of how we solve complicated problems with simple solutions. We listen to people, support people, and recognize that when we invest in the greatest gift that we have, the children of our community, the dollars we spend there pay the huge dividends that we expect them to. I'm a mental health professional beyond my work in government. And you've heard already, the impact of these critical few months in the first few years of a young person's life. We built so many systems that try to address what happens when that support has not been there. We've created complex bureaucracies and hurdles for people to jump through, sometimes just to show that they've suffered enough to deserve a little bit of support. But we can do something different than that, can't we? We've done it here. And every baby that gets a fresh, nub to chew on because they've had the support that their family needed is really an accomplishment of this whole community. And I'm so excited to know that we make that commitment to upstream investment rather than solving a downstream crisis. So while we can bask in a little bit of the baby smell that we get around here today, let's watch that flourish through the community. Families to feel supported and inspired that now is the time to expand their family, to hope for the future. There's so much that calls us not to hope, but when we look into the future eyes of the people who will lead this community, we know that hope is something we can never, ever let go of. Thank you to all of the partners, the Community Foundation, our state legislative delegation, the families that will come forward, and there's just a tremendous day to celebrate today. On behalf of Kalamazoo County government, the rest of our Board of Commissioners, thank you all for being here. Thank you so much.
Thank you so much. All right, so next I would like to announce and introduce Cherry Bell, who is the supervisor of Oshtemo Township. Cue the music.
Good afternoon. It is my absolute pleasure to be here with you this afternoon with our partners, our friends, and my esteemed community colleagues. I want to just share first that in another time, in another place, in another position, there was a visionary leader who formed a steering committee that turned into Cradle Kalamazoo. And she was kind enough at that point to invite me to be a member of that steering committee that ultimately became Cradle. And when Alyssa called me, I think it was even on a Friday, Alyssa from the Community Foundation, and said, "Hi, Sherry, do you have a minute to talk?" And I'm like, "Sure." And she's like, "Oh, by the way, Oshtemo is going to be an RX Kid expansion zone." I cried, and then she told me I wasn't allowed to tell anybody yet. And I held my word, except for the guy that lives with me who's really good at keeping secrets. So I am the supervisor of Oshtemo Township, and I'm honored to be here with you today at the beautiful Oshtemo Branch Kalamazoo Public Library to welcome RX Kids into the Oshtemo community. I want to start by recognizing and thanking the many individuals and community groups who made this expansion into Oshtemo possible. There are so many of you. But most importantly, thank you to the families and the caregivers who continue to share their stories and make it clear why this matters. You are the reason for this work. This program protects our youngest and most vulnerable residents and helps ensure every baby born in Oshtemo gets the best possible start. Why was Oshtemo chosen? The decision reflects need and readiness. Public health data identified areas for improvement, and Oshtemo demonstrated the willingness and infrastructure to act. Why are we so excited to welcome RX Kids to Oshtemo? Because this program brings meaningful, practical support to families at one of the most important times in their lives. At its core, this work reflects one of the most important responsibilities of local government, supporting the health, safety, and overall well-being of the community. but no local government board, no matter how dedicated, can do that work alone. The outcome we all want, healthier families, safer communities, and stronger futures, depends on meaningful partnerships. Programs like RX Kids are successful not because of any one entity, but because of the collective efforts of all. And I just want to say, I want to pause, and my notes are almost concluded. This is a room full of visionary, dream-seeking, action-taking change makers. And I want to give you an applause, and I want you to give each other applause. As a township, we recognize our role in supporting the success of this program. We are committed to ensuring our staff are informed and trained so they can help guide residents to the right resources. Oshtemo will strive to share information widely and thoughtfully, making sure that families who can benefit most from RX Kids know how to access it. We will continue to strengthen connections with local partners so communication is clear and support is consistent. In Oshtemo, we pride ourselves on being a caring, proactive community. The launch of RX Kids is proof of that spirit into action. RX Kids is not just responding to a problem, they are changing outcomes for our children and setting examples for others to follow. Thank you for everyone who worked to bring RX Kids to Oshtemo, and I look forward to continuing to work together so every child has the healthiest start possible. Thank you. Paperwork. Don't steal baby.
Unfortunately, the baby can't be stolen. All right, so before I introduce our next speaker, I would just like to highlight that the next few speakers that we have coming up are the people who are at our Capitol fighting for this program, advocating for this program, and making sure that our families in Michigan are being supported. And so I'd like to say a huge thank you before I introduce our first person, Senator Sean McCann.
Well, thank you so much. I know you've got several politicians lined up, so I hope you booked your whole rest of your afternoon to be here today. But no, I'll actually be really short because I think that a lot of what's been said is already critically important, and I don't need to repeat it. I'm going to be a bit like Michael Horrigan, which is to say that he's a numbers guy, I'm a budget guy. And I've been in the State House and in the State Senate for 11 and a half years now, and all that time I've been on the House and Senate Appropriations Committee. And you know why? Because budgets are where we express our values. That is a real way to get things done. Yes, there's policy. Yes, there's laws. We do all of that. But budgets and where we put our money is how we show our values. So, Michael, I'll be really interested to sort of see if you do a return on investment study on the tax dollars that flow into the equation here, because what I've been proud to do is deliver for people in Lansing to bring the dollars home to make this work in Kalamazoo County, which I'm proud to represent, but also, as you said, you've been in Jackson today, you're expanding across the state of Michigan. So the power and the stories that we're hearing in this room are repeated across the state of Michigan, and that's something that we can be proud of because I wear the hat that says Kalamazoo County and a little bit of Van Buren County, but I also wear the hat that says the state of Michigan, and we all want to thrive and see those inputs bring returns. So $250 million, plus $270 million, plus we're there fighting for more every day. My two colleagues are going to come up. We're all on the Appropriations Committee, as it turns out, in the House and in the Senate, and that's where I think we bring maximum value, maximum return on investment, maximum powerful spend of your dollars, your tax dollars, plus the philanthropic dollars to make it all work here in Kalamazoo and across the state of Michigan. Thank you.
Thank you, Senator. I would also just like to make a note. Shiloh was a big fan of your speech. He was babbling the entire time, and I think he wanted to speak with you. All right. So next, I would like to introduce up Representative Matt Longjohn.
Oh, there's a lot of faces here. I was sitting in the front and didn't see all of the faces. But
couldn't agree more with what's been said by multiple people. What an incredible community we have here to show up for our youngest folks, and it's an investment worth making. I think we all know that. I'll keep my comments short as well. If you've met me in the last year and a half, you've probably heard me say that I'm the only preventive medicine doctor, public health physician that's been elected to the state legislature since they've been keeping records. This is a program that brings such a huge smile to my face. I've spent 25 years working on addressing social drivers, figuring out how to get over what Commissioner Strebs said is the political hurdle to making things happen. The data have been clear for a long time, right? This isn't a mystery. It's been, what does it take to get it done? And it's everyone here that I know that made this happen, and it's so incredibly cool for Kalamazoo. I do have one bone to pick, and that's with Mike. Your numbers are definitely wrong. You're only looking at a year or two of data. And when you talk about kids and families not being subject to evictions or child welfare cases, what I know as a preventionist is that we can pay now or pay later, and that the downstream effects, the ripple effects, are not being measured by your study yet, right? We have to take a longer view of these evaluations to know where the return on investment actually will lie. And I strongly suspect, I'm confident that the return on investment is much higher than we're currently seeing. We just haven't had it cook enough time yet to see those benefits.
The most pleasant criticism I've ever received.
So the only other thing that I really want to add is to put just a tiny bit of context on this. It's too damn hard to pay for a gallon of gas right now. It's too damn hard to pay for childcare right now. And I know we're doing something about that in the county. I hope everybody's paying attention. It's too damn hard to pay for rent. It's too damn hard to pay for diapers. It's all of those things. And unfortunately, with inflation numbers being reported this week and the costs of things continuing to rise, the end is not in sight for a lot of those factors. Similarly, our state budget has a big problem. We start this year, as Senator McCann mentioned, with a huge deficit, $1.8 billion, that was just a cost shift from the federal government to the state government. We have to make up for that while trying to keep these incredible programs going. But here's the point. We cannot cut our way to better communities, to stronger families, to healthier children. We have to make smarter, wiser, targeted investments that guarantee those ripple effects that haven't been measured yet will be felt by Shiloh and all your buddies. I'm just so grateful to be a part of this community. Congratulations to everyone involved. Thank you. Thank you.
Thank you so much. I think we have a trend. I think Shiloh might like his representatives because he was babbling over there too. All right. And then next, I would like to introduce Representative Julie Rogers. We're going to go 3 for 3 on the representative.
Well, as you get to go towards the end, like Senator McCann said, everything's kind of been said, so I'm going to kind of abbreviate on the fly. But I am State Representative Julie Rogers. I represent House District 41. That's most of the City of Kalamazoo. The pilot, yay, RX kids. Most of Kalamazoo Township, a little bit of Portage, and a little bit of Comstock. And I had the privilege of being the House Health Policy Chair in the trifecta, and so far it has been the honor of my career. I'm going to argue with Senator McCann later about appropriations versus policy. I'd say they're both really important. But we were able to get a maternal and infant health equity package across the finish line that I helped champion that laid some of the groundwork. So the RX Kids cash assistance is important, but so is the insurance policies. And so what we got required coverage for the first time ever, mental health screenings for postpartum mental health issues. Also, preeclampsia is a very common condition, high blood pressure, and so getting blood pressure monitors required that insurance would cover these. So this goes hand in hand so that insurance will help cover some of these basic needs, so that moms and families can spend these dollars on other things and not quite so much of healthcare. But I am so thrilled for these expansion communities. Congratulations to Oshtemo, Wakeshma, and Galesburg. And what I will also say is that we are all in this together. Just like the Kalamazoo Promise was a great gift, it was not successful by itself. In year one, we looked back and there were gaps. Same thing with RX Kids. This is not something for Cradle and the partners to execute on their own. It takes all the oars rowing in the same direction. Amen? And so I'm proud that my team was able to knock on 9,000 doors last summer to get the word out. We did a postcard about my district service office and how we can help, but also about RX Kids and the cash assistance. And we knocked on many families' doors that didn't know about it. We knocked on couples' doors that were waiting to conceive because they couldn't afford to have a baby. And the tears of joy in their eyes talking to them when we shared this wonderful news was priceless. So I encourage all of you to get on board and to help get the word out with these expansion communities because it's going to be so impactful, and I'm so excited. The last thing I will say is that I will echo my other colleagues' sentiments about the budget. We are in the fight of our lives right now. We are hoping to get a budget delivered to you all by July 1, but not everyone in the state legislature agrees with us. So you can help by reaching out to your lawmakers and talking about the importance of funding RX Kids and what it is meaning for you and your communities and your children. And we will continue to fight for these dollars. Thank you so much for having us, and congratulations.
Thank you so much. And we did go 3 for 3 on Shiloh participating in legislator speeches. If only he could vote.
He will.
And he will one day. All right, so next I would like to introduce the person who meets with our mamas and our babies in Kalamazoo and will continue to meet with babies and mamas in Kalamazoo County, Hanna Lecker.
Hi everyone, my name is Hanna and I'm the Program Associate with Give Directly for Southwest Michigan, and I'm also a proud resident of Kalamazoo. I've lived here for over 10 years, yes, thank you. And so Give Directly, as I said, is the program administrator for RX Kids. And I want to take a few moments to share what that looks like day to day, because there's a lot that goes into running a program like this, and a lot of it's behind the scenes and people don't know about it, which is a little bit by design. But to give you a little peek behind the curtain, Give Directly specializes in the design and delivery of cash programs. We've now delivered over $1 billion, with a B, dollars globally, reaching more than 2 million people worldwide. In the United States alone, we've delivered more than $332 million in unconditional cash transfers, and that's specifically just for Americans since 2017 when we launched our programs here. That experience is what we bring to RX Kids, not just a check writing operation, but a full end-to-end infrastructure built to enroll, verify, and pay tens of thousands of Michigan moms and babies every year. So what does that actually mean? It means that we built the application platform with our tech partner AidKit. We review every single submission. There are real people looking at every single application, such as myself. We verify eligibility, we resolve payment issues, we distribute debit cards, and after every single payment, we follow up with recipients to make sure that the money is actually landing in their hands, not stuck in a system somewhere. Our team includes 9 full-time staff members, 6 of whom are Michigan residents. Every RX Kids community we serve has a Michigan-based staff lead. These are not faraway administrators processing paperwork. We are your neighbors. We sit with applicants and troubleshoot issues, and we know this state. One thing I'm especially proud of is our commitment to what we call recipients first. That's not just a slogan. It's a lens through which every design decision is made. Our application takes less than 20 minutes, can be completed on a computer, smartphone, or tablet, and is available in multiple languages. And we've built in protections so that receiving RX Kids payments doesn't jeopardize a family's access to most other public benefits they depend on. We want this program to add to people's lives, not create new complications in them. We also take seriously our responsibility to protect both recipients and the integrity of the program. We continually invest in fraud prevention tools, things like detecting doctored documents, because every dollar that's protected is a dollar that goes to a family who genuinely needs it. And the families do need it. We've had some great points by Dr. Long John about the need in our communities and beyond. And I think about recipients and families like Melina, who moved from Montana and now faces a 90-minute drive just to reach a birthing hospital in the Upper Peninsula. She used her RX Kids payments to buy breastfeeding supplies and to insulate her 102-year-old farmhouse against Michigan winters. When she was asked about her experience, she said that RX Kids showed her that someone cares about her and her family without judgment. That's the whole point. I also think about Nora, a 25-year-old mother of 4 working as a nursing assistant in Pontiac. She used her payments for groceries, diapers, and new tires, and she's planning to use future payments to go back to school and build a bigger home for her family. These are not abstract outcomes. These are the kinds of decisions that get unlocked when a family has just a little more breathing room. Today, as we launch these new sites in Kalamazoo County, I want all of those families to know we built this program for you. Every process we've designed, every safeguard we've put in place, along with Dr. Mona and team, of course, every follow-up call we make, it's all in service to making sure this program works the way it's supposed to, for you and for our community. Thank you.
All right, so our last speaker of the day, and most definitely not definitely not least important, including with his mama, Naisha Wright. I'll give him back to you, I guess.
Oh, that was high? Yeah. So as you know, this is Shiloh, our Crado's little favorite coworker. I am Naisha Wright. I am the director of Cradle Kalamazoo, but I am also an RX Kids mom. And this is my very happy, opposite of me, social baby. It was so wonderful. I'm going to be honest, I initially was not going to apply for RX Kids. But my supervisor, Janika, coming from Flint, as soon as she found out I was pregnant, was like, this is coming and you're applying, right? You applied, right? You applied, right? Aren't you there yet? You applied, right? And then Hanna as well was like, you're going to apply. So I did, and I'm very grateful that I did. While I was 7 months pregnant, I ended up having to move abruptly. And that initial payment assisted a lot. And then afterwards, I didn't really know what I was going to do, but I was very grateful to have the $500 a month. It set up things for him, including a stockpile of diapers. Very much needed. Kids have blowouts. Not only that, it assisted in paying for daycare. It also assisted in me setting up an account for him, starting from when he was about 1 month old, so that I can build a future for him. This is his new thing. This is the new skill that sleep regression came with. But I am just happy to have it. Regardless, having a child, no matter how much money you make, the resources you have, and the assistance you have, it is a financial hardship. And that $500 definitely did provide me a little cushion. So, yes, it did. But thank you so much, and I am so proud to be a part of the organization that is a part of the expansion and bringing it to Kalamazoo, and I'm happy to be somewhat of a spokesperson for Kalamazoo County and have a nice little RX Kids baby. Thank you.
All right, thank you, Naisha. Naisha was our last speaker of the day, but before we all go, I would just like to say, from our funders to our representatives, to our providers, our healthcare workers, our doulas, right? All I've heard about today from everybody who's spoken is that at the end of the day, love matters. Love is what gets our babies the thriving futures that they deserve. Love is what drives all of you to do the work that you do day in and day out. And love is why ultimately we are here today. So on behalf of Cradle Kalamazoo, the Kalamazoo Foundation, RX Kids, thank you for being a part of the village. Thank you for being a part of love. And thank you for continuing this work with us today. Moving forward.